Good evening. My name is Dr. Ngaga again. I want to welcome you to my channel. I know it has been a while, since I posted on this platform, but then I thought it's high time, I brought up an issue that I feel is so urgent. And this really has to do with the fact that, we have been actually, talking about COVID-19 and for some time now. But I'm really surprised that up to now, the people still believe that this is a hoax. Um, I happen to work in a hospital, and what I can assure you is COVID-19 is real. Not only real, it's actually dangerous, it's deadly to some people. I'm not going to say that that really affects everyone, but remember, I often tell people you cannot tell how strong or good your immune system is unless you have a clear medical bill or certificate from a medical practitioner, citing that your health is you're healthy. Um, so when you say that this thing affects very few people, especially the elderly and the rest, we have actually 30-year-olds dying and actually being very critical. I even hear just the other day that a classmate of mine in actually college was admitted to ICU, very critical. Of course, he pulled through, but actually after being in ICU for over 4 weeks, so you can imagine. But then he made it. But what that really tells you is that it doesn't matter how old you are. Your immune system could be compromised at any time. You get a really bad flu, very severe infection, and that weakens your immune system. Your diet is not, balanced. That alone can affect your immune system. So when it comes to an issue on who gets infected, just know that anybody can get infected. On who gets serious, you can really not predict. You can't say that so and so is going to be okay in spite of the infection. So I think what I want to emphasize today is just know that your infection could be as severe as that of someone else who you feel is more immunocompromised than you. So let's take those precautions. Let's wash our hands. Let's sanitize. Let's keep that distance, and then above all, let's wear masks if we can. Just the other day, passing through one of the towns just near Nairobi, just about 5-10 kilometers away from the CBD, I happened to find people just living a normal life. Without masks, people hugging, people working together, and they seemed comfortable and happy, and life was usual. But then I asked myself, do these people really know that any of them could be infected, and this really could keep spreading? I think what is good or encouraging at some point is that a majority of people are actually going to be healthy, or even just not even notice that they've had the infection. But then you cannot predict who that is going to be. It could be you, it could be your neighbor who is going to get a really bad disease. So we just need to be careful and cautious. Just the other day, looking for a bed for a patient really took so long, and we actually almost missed a bed. We ended up getting a bed, I think, after 4 hours. And that was because someone's result came and it turned negative. And so I think so it was actually time for them to be discharged. So you see, looking for a bed for 4 hours for a patient who really needs high oxygen and who needs to be near a machine, that is really something to really be worried about. But people in the remote areas, in the villages, seem to be so comfortable because they haven't seen a brother, a friend, a colleague, or sick. And so that's why we need to take personal responsibility that this thing exists. I think we need to make sure that we do the right thing. Let's do it as if we actually the people affected, as if we're the people going to be affected. And let's take all precautions, because once you're safe, it means your brother or sister is safe. The other thing is that I've found that is so disturbing is that people are really dying at home. People are not going to hospital because of fear that they will get it, COVID-19 in hospitals. People are so comfortable going to clubs and hotels to eat and buy, but they're not comfortable going to hospital when they feel unwell. This really breaks my heart, because we're actually going back to where people never used to go to hospital. People die, where you find the death rates were actually very high because someone gets a chest infection, they never bother, they keep taking cough syrups, some herbal concoctions, until this infection hits the entire lung, and then the person passes away. So I think when you get sick, let's seek medical attention, especially from qualified practitioners, because that actually maintains our safety. Remember, these hospitals, most of them, we're taking a lot of precautions to protect not only ourselves, but also patients who come in. Most of us have families, most of them are actually young, and most of us are really proud fathers and husbands. So you actually come to work knowing that you need to protect your family at home. So you can't come to work and work carelessly, do things in the way you want. So you've got to use those precautions. And so when you find people saying that I'm gonna get this COVID at hospital, I find it so strange because in hospitals where actually everyone is wearing a mask, a patient comes in, they're told you have to wear a mask. If they're suspected of the infectious disease, they're isolated and tested there, everything done in that isolation room before they are moved actually either to hospital or discharged home, depending on how the results turn out. So it's so troubling that we are actually finding people having issues at home, and people are having high blood pressure, diabetes. They have never gone for their checkups because they're afraid they will die or they will get the COVID-19. But you see, if you really need to do a refill of your medication for your blood pressure, just either give the hospital or pharmacy a call, or walk there, honor your mask, spend the least time there, and that really works. And again, I've realized that even the waiting times are less because people are trying to make sure that there are no queues in hospitals, so that people don't get clumped together, and of course that can cause spread. So this is actually mostly an initiative by hospitals, and we should actually try and support this as a community. That's the only way we can actually move forward. That if we don't work together as a team, if we really don't trust the experts to give us the expert opinion, and if we politicize everything, including healthcare, then I think we're actually headed to destruction as a country. I think I would want to stop here today, but please, let's take all the precautionary measures. Let's wash our hands, sanitize, let's keep social distance, and above all, let's wear face masks. I have just the other day, a patient comes in and they're coming for screening because a neighbor's kid turned to have COVID-19 just a few days later. So I ask myself, are we still visiting people in this COVID-19? Why are you still visiting people? Is it so hard to really stay in your home? And you see the whole family is now, under quarantine. They have not left their home for almost 7 days. That's just because they allowed a neighbor's kid to come in, and then the neighbor's kid turned positive later. So I think let's be cautious. Let's know that this thing is real, and actually it can actually take away our loved ones. So let's be cautious. I think I want to stop here today, and I want to wish you a good evening, and kindly watch the video, share, hit the subscribe button, and above all, if you have any queries, if you want anything clarified, feel free to really actually talk about it. If you have any queries, if you have any criticism, I'm really open to all those. I think for now, have a good evening. Thank you so much.